Dix. I'm BC's Minister of Health. To my right is Michael Marchbank, who's been the lead of our program in response to our surgical renewal commitment, and happy to be here today to talk to you about surgery in BC and where we are 1 year after the very significant decisions that were taken in March of 2020. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. A year ago, we postponed non-urgent scheduled surgeries to ensure our hospital had the capacity for COVID-19 patients. Everyone will recall the context. COVID-19 was new. A pandemic had been declared by the World Health Organization, and very significant steps were being taken in BC. We had images from China in Wuhan, from Italy, from ultimately the United States, of hospitals overrun with COVID-19 patients and their impact on care. We did modeling based on what we knew, the situation in Europe, the situation in China, the situation in other countries, and made a series of decisions to ensure that our healthcare, our acute care hospitals were protected and safe. And so this week, 1 year ago, I announced the decision after much consideration, especially over a weekend in March, that involved the provincial health officer, involved the Deputy Minister of Health, involved our health authority teams to postpone non-urgent scheduled surgeries. A decision, and just to put that in context, we do several of thousands of those every week in British Columbia, and these are all medically necessary surgeries in the public healthcare system. It was, I would say, one of the most significant and difficult decisions that I've ever been part of. And it was the right decision then, and I say it was now, from this vantage point, it was also the right decision. We forget sometimes the impact of those times, the impact on our acute care hospitals, the impact on those providing care, and the need to ensure that we had hospitals that were safe and were dealing with a situation which included massive unknowns. I'm very proud of our teams and how they responded in those times, as they continued, of course, to perform urgent scheduled surgeries and emergency surgeries. At the time, I asked Michael Marchbank, who's with me today, to provide his guidance and leadership to surgical renewal, because we knew the moment we started to resume non-urgent scheduled surgeries that we had a job to do. He agreed, and on May 7th, we released our commitment to surgical renewal in BC and started calling patients to reschedule their surgeries. On May 18th, non-urgent scheduled surgeries resumed in BC. Since then, everyone involved in delivering surgeries has been doing a remarkable job, the job we count on them to do, to get patients the surgeries they need. From health authority staff who called waitlisted patients, to the surgical care teams in the operating rooms, to the friends, families, and caregivers of patients who helped them recover from surgery. Everyone is doing their part, and I want to thank everyone involved for their tremendous efforts, their unparalleled achievements that I think stand up in the world as a remarkable response to a very challenging situation. That action last March 16th meant the delivery of 32,400 fewer scheduled surgeries than expected. And the postponement, because we scheduled surgeries usually a couple of weeks in advance, direct postponement of 15,373 scheduled surgeries. Our task, therefore, was massive, and our commitment was clear. Deliver surgeries that were postponed due to the pandemic. Schedule and deliver surgeries that were not scheduled due to the pandemic. And change the way we deliver surgeries in BC to get more patients their surgery faster, because we don't stop having new patients. We don't stop having patients in need of surgeries. In monthly progress reports since then, we provided detailed information underpinning our weekly updates on our progress in fulfilling that commitment to patients. Today, we are releasing the 7th, 8th, and 9th of those monthly reports, covering the period from November 13th, 2020 to February 4th, 2021. Here's where we stand based on these monthly reports. We delivered surgeries to 95% of the 15,373 patients who were called during the first wave of COVID-19 and had their surgeries postponed, and who still wanted to pursue a surgical treatment. We performed 23,502 urgent scheduled surgeries in the period, 1,731 more than the previous November to February timeframe. We reduced the waitlist size for urgent cases by 12% compared to February before the pandemic last year. We performed 36,724 non-urgent surgeries, including 5,395 non-urgent surgeries performed for patients waiting longer than 2 times their target wait, a 36% increase compared to the previous November to February timeframe. We reduced waitlist size for non-urgent cases by 9% compared to February of last year. We decreased the total waitlist size to 84,075, a 10% decrease compared to February last year, and a 16% decrease compared to the peak waitlist size on May 28th. We added 5,246 more operating room hours over the previous November to February timeframe. We completed 78,323 scheduled and unscheduled surgeries, 2,337 more than the previous November to February timeframe, including 2,922 more scheduled surgeries and 585 fewer unscheduled surgeries. We launched 70 initiatives across all health authorities to increase operating room time and capacity by extending weekday and weekend operating room hours, to improve operating room efficiency, opening new and unused ORs, and adding to our private surgical centers contracts. We have hired 44 surgeons, 54 anesthesiologists, and 4 general practice anesthetists since April 1, 2020. We've hired 410 perioperative registered nurses, 55 perioperative licensed practical nurses, 254 post-anesthetic recovery registered nurses, and 346 medical device reprocessing technicians since April 1, 2020. We have started training 274 surgical specialty nurses since April 1, 2020, of whom 172 have completed their programs. And we now have 96 medical device reprocessing technologist students in training. Last spring, we made a commitment. I have in my mind's eye the many people who called me to tell me personally about the impact, and who emailed me personally about the impact of surgery in their lives, what it means to wait, what it means to have your surgery scheduled then postponed. We said we would deliver the postponed surgeries. We said we would schedule and deliver surgeries that were not scheduled. We said we would change the way we deliver surgeries in BC. And in the months since then, we have delivered on that commitment each and every day. I want to thank the members of the HEU, members of the HSA, the members of the BCNU, the members of the Doctors of BC, the leadership teams we've had in place, and especially the next person who's going to speak, Michael Marchbank, who will speak in further details about key aspects of our progress, and who's played such a big role in all of the achievements we've done over the past year. Michael, over to you.
Thank you very much, Minister. I'm very pleased to be here today. As we've emphasized in previous monthly reports, there are 3 key components to surgical renewal: focusing on our patients, increasing our surgeries, and increasing our essential personnel. If you look at slide 1 that the Minister has reported on, it tells us that we're delivering on the surgical renewal commitment to our patients. We have performed 2,922 more scheduled surgeries than in previous November to February timeframe, meaning patients are getting their surgeries more quickly, and we're bringing down our wait lists. We should find this significant, and it shows we're following through on our priorities and are focusing on the patients with the highest needs. As we look at focusing on patients, it's important I think, to put that in context, especially with regard to urgent patients. These are patients that are waiting for very complex surgeries, such as cancer, neurosurgery, and cardiac issues. If we think of our own lives and those we love and care for, we know that urgent patients are anxious. Their surgeries need to be done quickly, not only for their physical health, but for their mental health and for their own peace of mind. Performing 1,731 more urgent surgeries than in the previous November to February timeframe means we're making a significant, and I would say very welcome, progress in providing the right level of care to patients who are understandably anxious about getting their surgeries. That's why reducing the urgent waitlist size by 12% is so very, very significant. As we look at performing more scheduled surgeries, you'll see that in our 9 monthly progress reports, in our 9th monthly progress report, we performed 1,300 more scheduled surgeries than in the same time frame last year. What is significant here is the month-over-month improvement we're seeing in the past 3 months, where an additional 2,922 additional scheduled surgeries were performed. That's what a build in a momentum looks like, one that stems from adding capacity and personnel and taking the care to do it right. Important here also is the 1,489 additional scheduled surgeries performed in July and August. You might recall that we worked to reduce the traditional summer slowdown, and the result of that was more surgeries. Performing more surgeries is also made possible by adding capacity, and the next slide shows how we're doing that. Every health authority has played an important role in adding capacity. This is a tremendously powerful statement about our healthcare system and the people who work in it. It's the folks in the system who make something like this happen. People have responded. We continue to add new actions, and we continue to add more surgical hours. This augurs so well for our future in terms of not only catching up on the patients whose surgeries were impacted by COVID-19, but making a permanent increase in surgery for the long-term patient demand that we know is there. This will greatly benefit our patients and bring down wait lists. I just wanted to say that this kind of achievement in capacity increase in such a short amount of time is unprecedented in my career in BC healthcare. Simply unprecedented. And of course, all of this is a function of the personnel, and one of the key components in our surgical renewal is increasing essential personnel. This takes us to our next slide. Any system in healthcare generally will be able to respond to a crisis or emergency. But from a system point of view, and the long-term benefit of our patients, it's the investments that we're making in training and recruitment of people that will sustain the surgical renewal commitment. So the 274 surgical specialty nurses having started their training, and the 172 that have completed their training, is a permanent change for the better. As is the training that we're doing for medical device reprocessing technicians. These are key and necessary structural changes to increase the human resources that are required to sustain on an ongoing basis the increase in our surgeries. And to me, this is a meaningful increase in the skills of the professionals who are vital to making surgery happen for our patients, and one that should inspire us. The last slide shows our progress in recruiting people. And this kind of progress in the hiring of additional personnel to support surgical renewal is another essential element in how we deliver surgeries. What the slide doesn't tell us directly, and that we need to recognize from it, especially particularly with the surgeons and anesthetists, is that many of them are new graduates and are coming from outside the province. And what we know is that BC's surgical renewal commitment is a draw. It is attracting people to come to our province. It makes BC an attractive place to come and practice medicine and to be part of the surgical renewal and striving for achievements in that regard. We should not at all underestimate the power of that in recruiting our personnel. In closing, when you look at the progress and you look back at the last year and you take a look at what has been accomplished, it tells us much about our BC healthcare system. From the hard work of the public health staff in designing the right protocols so that patients and providers were comfortable in providing surgical services during pandemic, through to the recruitment, right through to the doctors, nurses, anesthetists, and cleaners, everybody doing their essential thing to get the patients their needed surgery. It tells us this: when we all pull together, when we have a common goal, and surgical renewal has become that, it is truly amazing what we can accomplish. It becomes a signal moment in people's careers and health, and in what we're doing to build a care system that gets patients the surgeries they need now and into the future. And on that final point, it's my privilege to turn it back over to the Minister.
Thank you very much, Michael. And I think it's fair to say all along in our surgical renewal commitment. We knew that when each of us worked to stop the spread, when each of us did our job, and I believe we have over the past year in BC, we help everyone involved in surgical renewal do their job in getting patients the surgery they need. Each of the monthly progress reports on our surgical renewal progress, the 9, including the 3 released today and the 9 released overall, tells a powerful story of achievement. We said some time ago that in a pandemic, everyone has an essential role in healthcare, and this has been particularly true in surgical renewal. I'd be, I think, remiss not to acknowledge the extraordinary role that Michael Marchbank has played in this. When I asked him to take on this project, he was in a well-deserved retirement. He had been president and CEO of the Fraser Health Authority when I became Minister of Health, and his guidance and support and commitment to people, I think, was extraordinarily valuable, and I knew he was the person for the job, and so he came out of retirement and took on a task which was Herculean, and he provided leadership in that task. And what I think is true of Michael, he's a brilliant public servant. This reflects extraordinary work by him and an ability to move other people to join in a common enterprise, which is remarkable. But every time Michael talks about surgery or other issues in healthcare, you know, and there's lots of things to talk about, always human resources and the challenges and equipment and the protocols required to do surgery safely during COVID-19. But at the heart of what Michael does that I so admire is that he always has the patient at the center of what he does, and of the need to support patients, the need to provide surgery for patients who are waiting for care and often waiting in pain for that surgery, putting their lives on hold for that surgery to happen. That's what makes Michael Marchbank, has made him a great British Columbian. As you know, as you may know, in the next few days, Michael's role will end as he prepares for a cross-country move to continue his family's journey together and open new chapters. I know he leaves knowing how much his efforts have allowed patients here in BC to do exactly the same, to move on with their lives after getting the surgeries they need. And on behalf of a grateful province, Michael, I want to say thank you. Through our surgical renewal commitment, we said we get more patients their surgery faster, and we're doing exactly that. And when something as critical as surgical renewal is working so well, you don't pause, you don't let up, you go full steam ahead. And that's exactly what we'll continue to do. And with that, I'm happy to take your questions.
Thank you, Minister. As a reminder to reporters on the phone, please press *1 to enter the queue. You'll be limited to 1 question and 1 follow-up today. Please also remember to take your phone off mute, as you will not be audible until your name is called. Our first question is from Binder Sajan of CTV. Binder, please go ahead.
Hi there. Minister, I just wanted to ask, so with regards to all the training of the new staff that's coming on board, I know you said that there's typically points in time in the year where a lot of people take time off. And I'm wondering, you know, with the vaccine coming and possibly in the future, maybe in the fall, restrictions kind of easing a bit, are you expecting a number of people to take time off, and will there be enough staff who've been trained to kind of pick up the slack so there isn't another slowdown in terms of surgical renewal?
I think the slowdown was not a slowdown, it was a stop for a whole bunch of surgeries that took place from March to May. But the situation obviously wasn't perfect before that. It had been improving. We very significantly improved our situation with hip and knee replacements, with a lot of diagnostic procedures as well in the previous 2 years, in fact. These were achievements, you'll remember, Binder, that we talked about. And we came and spoke to people about. So they were important achievements. One of the significant changes in surgical renewal over the past year has been a reduction of summer slowdown. So we reduced the usual summer slowdown we do for surgeries to allow us to reduce surgical wait times and to get people the surgeries we need. We're also using our operating rooms more, often a further hour a day or into the weekends, or adding or not operating rooms that hadn't been used in years in order to meet this test. And also, of course, training people more. And so, yes, I believe that we're going to continue to be able to respond at a high level. While there will be challenges, and there are always challenges in healthcare, The challenges of the last year have been unique and unprecedented. We do have, and we have had, our acute care hospitals, even today, affected by outbreaks, which can affect on a short-term basis in important hospitals such as Burnaby in recent times, and now Chilliwack and Vancouver General Hospital, the University Hospital in Northern British Columbia, affect surgeries as well. We've had healthcare workers involved on surgical wards get sick. So things will get better, we believe, once everyone's vaccinated, once we ensure in a full sense our acute care hospitals are protected from COVID-19, which can only happen with an elimination or reduction in community transmission. So there's going to be some things that will be easier in the future. There'll be other challenges, but I think that we're moving to meet the challenge, but we're going to continue to have to do so. You'll note, and people have noted in the vaccination campaign, that we have many more elders in our province than other jurisdictions. And that is a wonderful thing, that people come here, that people live well in BC and come to British Columbia, but that also will increase over time the levels of age-related illness, whether it be cancer or type 2 diabetes or the demands on our surgical system. So we got to keep beating the challenge. It doesn't get any easier in the future, but if we can get to a point where we have some community immunity against COVID-19 as a result of vaccination, that will make things much easier. On the other hand, there will be other challenges. You know, people will need to take some pause in their life, but as a healthcare system, what I expect is once COVID-19 is over, that there will be demand for other challenges that face the healthcare system. So the short answer is I think we'll be ready for that, but we're going to have to keep training people, because the generation of people that's provided all these services up to now will need renewal.
Binder, do you have a follow-up?
Yes, and just on a different topic, a question from my colleague who's wondering about waits for getting into some of these vaccine clinics. We're hearing about hours-long waits, sometimes 2 or 3 hours. Wondering if you are surprised by that, if you're hearing that, if you think that's appropriate, and if you can kind of outline what the situation is, because I think the goal was to get people in and out in about 30 minutes.
Yeah, and I think in most places we're achieving that goal. There are going to be some waits from time to time. This is a massive enterprise. But I think our teams, I think we have approximately 190 sites in this period, this phase 2 period of vaccination. That doesn't include the support we're providing to homebound long-term home support patients, often going to their homes to deliver the vaccine. So I think our teams are doing really well. And we continue to add people to be involved in immunization for our efforts with the AstraZeneca Serum Institute of India vaccine. Of course, a much more prominent role in for community pharmacists. We're adding new groups of healthcare workers, including emergency medical assistants or ambulance paramedics, to be able to deliver the vaccine, especially in the Interior Health and the Northern Health Authority. This is very important. So we keep adding to our teams all the time. And there may be cases of people who've waited, and obviously we want to get the vaccines done as quickly as possible, because we want to get people in and out after they've waited the appropriate 15 minutes after vaccination. And so obviously we're looking into that all the time in concerns. We haven't heard a lot of them, but there are some places where people have had to wait a little bit longer. But we're hoping to continue to improve in the coming days. We've got a lot of people to vaccinate. You saw that yesterday. And over this next short period, 908,000 Pfizer and Moderna, and then the 68,000, and then the new 68,000, and the 136,000 doses of AstraZeneca. So all of that is going to be a big challenge, but I think our teams are up to the job.
Our next question is from Camille Baines from CP. Go ahead, Camille.
Good morning. I'd like to know if there is also an increase in staff for post-surgical care, like rehab for occupational type surgeries, injuries, or physiotherapy. Was there also a consideration about that with an increased number of surgeries going ahead?
Yes, there was. We had for example, expanded the nursing complement in the post-anesthetic recovery room. And we are expanding, as we said, other staff who support the surgical program, such as medical device reprocessing technicians. We are looking at more respiratory therapists. We are looking at more anesthesia assistants. We are looking at a wide variety of professionals that assist in that process.
And it's a very good question. As you know, the effectiveness of surgical programs sometimes has to do with very practical things, both before and after surgery. So as you're doing more surgery, you need more supports after, and we're looking to that. But also before, I think some of the most impressive work, I think Michael would agree, has been done by those people who prepare people for surgery, which includes healthcare professionals and healthcare workers, both in planning the surgeries and making sure people are there on time and are properly prepared, because the success of a surgery, particularly in a time of COVID, often depends on that. So that group of staff people, medical offices, assistants, and on the post-surgical side, needs to meet the new effort to have surgeries performed. And we're pretty excited about it. That's happened considerably, though, over the last few years, Camille. In the last year of the previous government, we did about 14,200 hip and knee replacements. In the last year prior to the pandemic, we did 19,000, which is an extraordinary increase in a small time. And that, of course, puts demands on exactly the things you're talking about. And so that process was already underway and has been underway for some time.
Camille, do you have a follow-up?
Yes. Where's the wait list at now? Is there a certain category of surgeries that's, a longer list than others?
Always. I think if you see what's happened to the wait list, I mean, in a time of pandemic when the average surgery, so the time of your average surgery is increased by some percent, I think it's around 4%. That's how long it takes. So to do the same amount of surgeries, you have to apply more resources. It takes more time to do the surgery. The total wait list has dropped, as I say, 10% against last February, prior to the declaration of the pandemic, and 16% since the peak wait list. And that's across surgeries. What we've given the most attention to are the people who've been waiting the longest. So as we report on these things, we've not just affected the middle group of getting surgeries and wait times, but the 90th percentile as well. We've reduced the number of people who wait the longest for surgeries. But obviously, if you need emergency surgery, you get it right away. There are very strict guidelines around cancer surgeries in terms of the time to get to those surgeries. And so there are urgent surgeries, and we've been performing those, and we never stop doing those. But non-urgent surgeries are essentially non-urgent because they're not life-threatening surgeries. But they're all significant surgeries. If you have difficulty with your vision, then eye surgery is pretty important. And if you are having difficulty moving around, hip and knee replacements are critically important. I think we all understand that. So across the classes of surgeries, but particularly for those groups who've waited the longest and those groups in urgent categories, that's been our focus. And I think the results that you can see across the 3 reports we've tabled today and the 9 reports we've tabled since the beginning of the surgical renewal commitment demonstrate real success across categories. And that doesn't mean there aren't challenges for people waiting for certain kinds of surgeries, but really the impact of this has been across the list of surgeries.
Our next question is from Les Lane from CP. Les, please go ahead.
Oh, thank you. I think in May, the original estimate was it would take 17 to 2 years to catch up on the surgeries, and the ballpark estimate for the first year alone was $250 million. Have you got an update on that number? Is it safe to assume it was more, given that you got there almost much faster than anticipated?
The fully catch up around health authorities, we're on track to do that. I mean, in some places, such as where you are in Island Health, it's happened right away, I think. It's been extraordinary, and even the greatest in Island Health. And considering, Island Health is a somewhat older population, we have significant demands there. And so you see, and you can see in the weekly reports we do how well they've done in Island Health. It's quite extraordinary. So we're on track to meet that commitment with the resources we have. And I think what's remarkable about what we've done is it shows what a public health care system can do. And this is public health care doing the work of public health care. And there's always a debate about surgeries and public and private care. This is a public health care system using all of its resources, including contracts, to reduce surgical wait times. And this is something you can only do, I would argue, in a public health care system. So we are meeting those commitments to catch up. We've, of course, done the surgeries that were postponed, and we're catching up because you have to do all the surgeries you usually do and the 32,000 more. So it's a significant achievement. And we're meeting that, and we're meeting it within the budget we have for it. So that's a positive thing. You'll remember when we did our MRI efforts to reduce wait times in MRIs, we did it by using existing resources more. And so people started getting MRIs at 3 a.m. in the morning. And what I discovered from what people call me is how much people appreciated and knew that. And we virtually never had anyone miss an appointment at 3 a.m. because people prepare for it and they want their MRI appointment in that case, and they get it done. And in this case, we've used the system we have now more efficiently. We've added time, we've added hours in the day, we've added care on weekends, surgeries on weekends in many places. We've opened existing operating rooms. And so this is the efficient use of the public healthcare system, and it shows what a public healthcare system can do when it's outstanding administrators and surgeons and nurses and healthcare workers do the work they do. And I'm appreciative to people for their patience, our patients for their patients, because you know, when I've heard from people what it means, all of this means to them. So, but I would say if you look at the numbers within these reports for Island Health, you'll see a health authority that has gone above and beyond for people in a difficult time.
Les, do you have a follow-up?
Yeah, just overall, you emptied out over 3,000 beds to make room for an onslaught of cases. I think there's about 150 COVID patients at the peak in spring. And I was struck by how people generally accepted that. You mentioned all the personal contact you've had with people who were on that waiting list. By and large, people seem to accept it. Did they not, or did anyone object to or call
I think
an abundance of caution?
I think if you were waiting for surgery, it was a very hard moment. And if you're a surgeon who knows, or a nurse who knows all the patients, it was a very hard moment. I think you have to remember the context. The peak, and of course, at the moment, yesterday, we had 286 people in hospital with COVID-19. And those people in the hospital are centered in our COVID-19 hospital. So that's particularly, there's a particular impact in Fraser Health. At the height in April, on April 5th, it was 149 people in hospital and 72 people in critical care at that time. But the context just before that was what had happened in other jurisdictions. And so what we decided to do in British Columbia is be prepared. And there are other factors, I would say. I mean, there was a lot of pressure on our healthcare staff with this unknown, who have contacts with people around the world, and many of whom, of course, have you know, cable packages and satellite packages that get CNN and other things, so we could see around the world what was happening. And we wanted to ensure we had PPE, we wanted to ensure that our healthcare systems were stable at that critical moment, and this decision was necessary for that reason. And some will say, well, the onslaught did not come as it did in Italy and it did in China. In retrospect, that's true. But from what we knew at the time and the impact it had in preparing us for COVID-19 at that time, it was absolutely the right decision. But when we made the decision, we made a commitment to people that we weren't going to just say, oh, well, it's a pandemic, that we were going to continue, and when we resume surgery, that we were going to deliver for them. And I think it's made a big difference that we have.
Our next question is from Martin McMahon from News 1130. Martin, please go ahead.
Hello, Minister Dix. I had a follow-up question to yesterday's vaccine announcement. We've heard from the Union for Handy Dart drivers, and it argues that given their members work so closely with those susceptible to the virus, they should have been included. Do you have a message to those drivers, and when will they be included in the rollout?
Well, everyone in BC is included in the rollout. The primary plan is an age-based plan. And I haven't heard many people argue that that's the wrong thing to do. So as of yesterday, as of today, I suspect around 39,000 people over 90 will have received the vaccine. There are about 50,000 people over 90. So they've actually received it, not just booked an appointment, but received the vaccine. Over 85, that number is, I think, about 28,000. So that's a large percentage of people over 90, a very significant, growing towards 50% of people between 85 and 89. And now, of course, more and more people over 80. So everyone agrees with that, and that's the primary thing, and that's what you see advancing our 70 to 74 and 75 to 79 population was a significant announcement yesterday. The second most significant announcement was for people with severe medical conditions, 150,000 of whom were going to start to get their vaccination in phase 3, and their time period was moved up. And those are the people often who receive handy-dart services. So protecting those individuals is important. And I think everyone would agree that adding them to the Pfizer and Moderna plan as directed by public health, a list developed by specialists in the area, was really important, and that happened. We did add, based on an assessment by the BC Immunization Committee, people involved in this work, we did an assessment of workers based on an assessment of the risk of transmission of COVID-19. Everyone in BC is essential to our effort, but not everyone has the same risk, and a judgment was made. We have a limited amount of AstraZeneca. Quite a bit is coming. 68,000 has arrived. We expect 68,000 in the last week in March and the first week in April. We'll start to use. We expect another 136,000 in April. That's not everyone. That's a limited amount. We may receive more. We heard news from the United States about their willingness to, because they're not using AstraZeneca in the United States at present, they're not, it hasn't been approved in the United States, that they're going to provide some of the AstraZeneca that exists in the United States to Canada and to Mexico. And that will again add and allow us to add people as well in other occupations to the list of priorities. But the key priority is to move through age groups, and that's what was advanced yesterday, and I think most people agree with that. It's a difficult decision, but this isn't about how essential you are, because handy-dart drivers are essential. Ferry workers are essential. Transit operators are essential. Everyone is essential. People who make things are essential. Everyone's essential in BC, in my view, and everyone will receive the vaccine and their first dose of the vaccine, we believe, by the beginning of July at the latest. Everyone's important. Everyone deserves it. These decisions were based on science, and there are always difficult decisions when you choose to protect one group and another group feels the need. I'd like to give it to everybody. I'd like to give it to everyone tomorrow. We're not able to do that, and I want to ask people to remain patient, because as we receive more vaccine, we're going to be, of course, based on the same approach that Dr. Henry has already put in place in our teams in immunization, based on the science, based on the transmission. We're going to get the AstraZeneca vaccine, potentially the Johnson & Johnson vaccine, to more and more groups of workers between, 18 and above. But the core of our effort, our age-based effort, is going to be at the center, continue to be at the center of what we do, and I believe that's the right course.
Martin, do you have a follow-up?
Yes, I know it's easy to cherry pick, but I mean, handy-dart drivers, I mean, they work very closely with vulnerable people, the elderly, people with disabilities. No thought of fast-tracking them?
Of course, there's thought of those things, and those considerations will continue to be top of mind for the BC Immunization Committee as they make recommendations. But think of what you just said. Elderly people, over 90, the vast majority now immunized. Elderly people moved up in the decision yesterday. People living with disabilities moved up yesterday. People with severe chronic medical conditions moved up yesterday. And so the people you're talking about, and I think it matters to everybody that those groups of people are protected. So one final thing, and this isn't your question, Martin, so that was the answer, because one doesn't want to go on too much about different things, but just to remind everyone who's vaccinated that is their duty. What being vaccinated does is makes you safer. It helps stop the spread. Every time someone's vaccinated, it's good for those who aren't vaccinated. And so it's a good thing for all of us that we vaccinate. But we still have a responsibility to follow guidance of public health and public health orders. A, because the vaccine isn't immediately effective. B, because it may still be possible to transmit. What it does is make you safer and all of us safer. But we still need right now, at a time when we had yesterday more than 600 cases, more than 300 cases in the Fraser Health Authority alone, we have to continue to follow public health guidance and public health efforts. This effort in this period when we're vaccinating is absolutely necessary for everybody.
Thank you, everyone. That's all the time we have for today. Thank you for joining.
Thank you. Take care.